I appreciate the opportunity to speak to delegates and guests this morning on a difficult but important topic. I'm proud that the Alberta Medical Association is showing courage and commitment to leadership by opening discussion on harassment in medicine, diversity, gender equity, and professionalism. We are one of the first PTMAs in Canada to do so. I am one of the silence breakers. With the momentum of Me Too extending to Me Too medicine, I went public with my stories on Twitter in November. I endured sexual harassment as a medical student by a preceptor in the mid-90s at a teaching hospital in Edmonton. My experience included sexualized looks and comments and inappropriate touching. When I declined an invitation to work with him at his private office, as I feared assault, I was belittled on rounds and received a low grade. At the time, I didn't think much of it. I felt there was no one to report to. I worried that I wouldn't be believed. And I didn't want to be labeled a troublemaker, which might affect the chance of securing a residency spot. I felt relieved to finish that rotation without being raped. As a result of sharing my story publicly, I was then interviewed by The Washington Post and Sujata Berry, the journalist who gathered the stories for Dr. Brian Goldman's Me Too Medicine CBC radio episode on White Coat Black Art. This aired March 3rd and is an excellent podcast if you get the opportunity to listen to it. I had never shared these experiences until this fall, and it caused me to reflect. I wanted to know, is this still happening to our learners? Unfortunately, after talking to medical students and residents, as well as faculty and the CPSA, I discovered, yes, this is still happening. The statistics vary, and I've read everything from 10% to 75%, but we need more data and research. This does happen to both men and women. There was a statistic that the Harvard Business Review posted, and it was that 46 out of 100 women will be sexually harassed by age 31, which is a pretty staggeringly high statistic. This is something that is underreported. It is because victims may not recognize what harassment is, and we need to educate them. There's a concern of negative repercussions. Because of the power imbalance in medicine, people can be worried about future career, training opportunities, and grades. There are no consequences often to the perpetrator, and we need to fix that in organizations. Also, as victims, you have the fear of not being believed and also of victim blaming. When I talked to the University of Calgary in Alberta, they have now classified harassment under a broader term of mistreatment. Under mistreatment, there's harassment, abuse, discrimination, intimidation, and unprofessional behavior. If you think back to your training, you probably remember yourself suffering something like this, or a colleague who suffered something like this, and we need to stop it. The College of Physicians and Surgeons of Alberta has a standard of practice, the sexual boundary violation. Dr. Coleus posted this on Twitter in January, and she said, "Repeat after me, a physician must not enter into a sexual relationship with a learner." You may think this is obvious, but we actually do have to say preceptors cannot date learners. As discussed, the perpetrators can be preceptors, but they can also be peers, med students with med students, patients, other healthcare workers, and sometimes it does not follow the power hierarchy. For example, a female attending may suffer mistreatment from a male resident. This week on Twitter, the discussion has been, are we getting confused between Me Too and gender equity? And Dr. Barron is active on Twitter. She's a surgeon from Ontario who was on the OMA board. Dr. Baxter responded to that, and she's our presenter tomorrow, that sexual harassment stems from power imbalance based on bias against women. So gender equity and harassment are connected. Workplace settings with gender inequity, which medicine has, is a breeding ground for sexual harassment. I felt this medical student's comment was very important. The frank truth is that many do not appreciate the impact that sexual harassment can have on its victims and largely devalue victim experiences. We have to remember that this seriously can affect victims, and of course that's going to affect their well-being. When they're managing patients, it's going to affect patient care if their well-being is affected in a negative way. So this is something that's important for the healthcare system. So what can we do personally? We can increase awareness, which is what we're trying to do today and tomorrow with Dr. Baxter's presentation. We can commit to bystander action. I hope that everyone leaves this meeting with the courage to call out inappropriate behavior. If you see something that's inappropriate or hear something, please act. And lastly, we're hoping that you would support the establishment of a working group, and that will be a resolution that you will see tomorrow. So what can we do organizationally? This is something that I hope the working group will look at. And for instance, I feel training is a big thing that we should consider. We can look at what's happening in the province as well as in the country and use best practices moving forward. I posted this tweet in December, and this is interesting. This was a journalist, Anna North, who covered the Me Too movement in the States for 1 year, and she had 3 lessons learned. The first was workplace harassment is about work. What that means is that it is not about sex, it is about the power imbalance at work. And people want to go to work and just work, and I think we all have a right to do that. The second lesson was harassment is a systemic problem. It requires systemic solutions. This would be what the working group would look at. It's not just as simple as firing a perpetrator. It's looking at why people are harassed, who's getting harassed, and we need to change that so it stops happening. Lastly, to move forward, we have to focus on equality. Gender inequity, discrimination, disrespect, and harassment are all interconnected. In your RF package, there's a bio on Dr. Nancy Baxter, who's presenting on Saturday. There's also a paper from Dr. Julie Silver from Harvard, and this is an excellent one-pager that talks about diversity and inclusion and some important definitions. And lastly, the CMA Charter of Shared Values. This is a vision of intra-professionalism for physicians. It identifies commitments to each other, to respect, to have integrity, to have reciprocity, and to have civility. In conclusion, it has been a relief to be heard. Once your voice is heard, you cannot go back. Work environments will change. As provincial leaders, we have a duty to be courageous and have these difficult conversations. We owe it to our learners, our colleagues, and our healthcare professionals. To champion change and create safer environments where everyone can thrive is our responsibility. Thank you.